Welcome everyone who's joining us. We'll get started in just a few minutes. Okay, thank you all for joining us today. Let's go ahead and get started. Thank you for joining us for today's webinar with the Ohio Legislative Children's Caucus on promoting and protecting child welfare. My name is Allison Paxson. I'm the Policy Fellow for the Children's Defense Fund Ohio, and before I turn over the mic to our caucus co-chairs, I'd just like to run through a few housekeeping items. First, if you've joined this call as a participant or attendee, your microphone will be automatically muted. For all of our legislators and legislative staff, you should have the ability to control your own video and audio settings. Feel free to unmute yourself for the Q&A portion of this webinar, which will be following our presentations. But I do ask that you make sure you are muted during these presentations so that we can avoid any feedback or background noise. If you're a legislator or legislative staffer and you find that you do not have control over your audio or video, please use the chat box feature to message me, the host of this webinar, Allison Paxson. Send me your name, the office you hold, or the office that you work for, and I will do my best to change your Zoom settings as soon as possible. And so everyone on this call will be able to utilize that chat box feature to share feedback or ask questions. So in the event that you do have a question, feel free to send it, and all of our participants and panelists will be able to view it. This webinar will also be recorded, so rest assured if you need to leave early, this content will be accessible to you later. And with that, I'd like to go ahead and turn it over to one of our Children's Caucus co-chairs, Representative Allison Russo. Representative, whenever you're ready.
Thank you, Allison, and thank you so much to everyone who has joined us today for this very important topic about promoting and protecting child welfare during COVID-19 and beyond. We're so pleased to have some wonderful panelists to talk about this topic, and my co-chair, Senator Lehner, will represent them in just a few moments. But I did want to say just a couple of words about the Legislative Children's Caucus. We exist, we are a bipartisan, bicameral caucus, and we have been meeting throughout this General Assembly to talk about very important issues impacting Ohio's children. And we do this to, number one, have some good conversations, in-depth conversations about these topics, and to be informed by experts and to be informed by evidence. But also, we feel that this is a time, and really well past time, to be tackling some of these issues as a state. And so we have been gathering usually monthly until COVID-19 happened, and now we've started these bi-weekly webinars, which frankly I think I prefer because we have more participation from across the state and it's easier for folks to join the conversation. So I'm so pleased that you are with us today. Regarding this issue of promoting and protecting child welfare, I do think that it's important, particularly given the conversations that we've been having in the last 2 weeks, to talk about. We know that COVID-19 has certainly brought to light many of the weaknesses in the system as it currently exists. But I think also, it's important for us to acknowledge the inequities, the system and structural inequities that also exist. And I think many of us, both nationally and across the state, have been having this conversation, an important and much needed conversation about race as well, and some of those impacts. I do want to just set the context before I send it and hand it over to Senator Lehner to introduce our speakers. But I want to point out that Ohio is one of only 5 states, where at least 1 in 7 children have 3 or more adverse childhood experiences. And when we look at this issue and look at some of the inequities on a national level, 1 in 3 Black non-Hispanic children have experienced 2 to 8 adverse childhood experiences, compared to only 1 in 5 when we look at white non-Hispanic children. And in 2018, over 100,000 of Ohio's children were referred to child welfare for abuse, neglect, dependency, or families in need of services. And when we look specifically at Black children in Ohio, they are more likely to enter custody, over 3 times as likely as our white children. And additionally, almost 100,000 children are being raised by grandparents in the state, and 4,000 are in formal kinship care arrangements. And of those children that are being raised by grandparents, 18% are Black children, though they make up only 12% of our state's population. And then when we look at the outcomes for children that are placed in foster care in terms of education and long-term economic impacts and court involvement, nationally, 49% of former foster youth are employed 2 years after leaving care, while only 36% of Ohio's youth are. And likewise, 96% of foster youth earn a high school diploma nationally, compared to only 43% of children in Ohio who are in this system. So clearly we have a lot of work to do on many different levels, and so I'm so happy to be having this conversation today. And so now I would like to introduce my co-chair, Senator Peggy Lehner, and turn it over to her to introduce our speakers.
Thank you, Allison, and I also am very happy to be here with you today. Technology and I never mix very well, so we'll keep our fingers crossed and say some prayers here. But I am really pleased that we're able to come to you via this technology in these bi-weekly meetings. This is the second that we have had, and we have several more scheduled. Allison has shared some pretty shocking statistics with you. We do know that in Ohio things are getting somewhat better. Governor DeWine increased the funding for children's services by $125 million, which has been helpful. And further legislation such as the Family First Prevention Service Act has provided Ohio with opportunities to rethink and redesign its systems to better support families and children. And then COVID came along, and all of a sudden the reports of abuse to children's service agencies are down significantly. Does this mean we're doing a great job? Nope, not at all. Unfortunately, what it means is that mandatory reporters do not have their eyes on our children at this time. Without school in session and other structural deficits that we're all experiencing right now, we just aren't aware of what's going on with our children, and that should be of grave concern to all of us. So we are trying to look right now, what do we need to do right now, and how can we deal with this unanticipated lack of reporting in face of what we suspect is an anticipated surge in actual neglect and abuse. To sort of set the stage for us on a national level, we have Stefanie Sprow with us. Stefanie is the Director of Child Welfare Policy for the Children's Defense Fund out of the national office. I'm going to allow her to go first and sort of set the stage, and then I will introduce some of the other speakers that we will be having this afternoon. So Stefanie, let me turn it over to you.
Great, thank you. I'm really excited to be invited to this really important discussion. Again, my name is Stefanie, and I'm the Director of Child Welfare Policy at CDF's National Office, and we have spent the last 3 months of this pandemic working with our national, state, and local partners, identifying the current challenges facing our most vulnerable children and families and those who are disproportionately impacted by the COVID-19 devastation, which falls heavily, unfortunately, on poor children, children of color, and those who are in or at risk of entering the child welfare system. We know this pandemic is placing significant strains on families who are attempting to navigate school closures, uncertain childcare arrangement, job loss, social isolation, all of which can contribute to increased risk of child abuse and neglect, which you'll hear more about from some of the panelists that follow me, and certainly the wonderful introduction that you just heard a minute ago. So I'm going to spend a minute providing an overview of the congressional action and what has happened to date to respond to this. To date, Congress has passed 3 COVID-19 relief packages that have largely been focused on providing resources to respond to the immediate disaster relief and economic needs of this country, but very little has been included in those packages to address significant challenges facing the child welfare system. Congress is currently developing their 4th COVID relief package, with the House already passing their version of the bill. Many of you may be aware of this. It's called the HEROES Act, which again, unfortunately, largely leaves out support for our child welfare systems to respond to this very serious challenge. There are some provisions in here that do have very small investments for older youth transitioning out of care and some investments in prevention, but it does not go far enough. In order to respond to this crisis and stabilize families to prevent an influx of children coming into the system, and mind you, this is also coming at a time when our child welfare system is just starting to slowly rebound from the devastating impact of the opioid epidemic, which led to a significant increase of children coming into foster care also. So we are urging Congress to act immediately and provide emergency funding to equip the child welfare system with the tools and resources they need to handle this crisis, and we are advocating Congress to provide this support through a comprehensive approach that addresses the full child welfare continuum, looking at providing services and supports for those upfront prevention services to prevent child abuse and neglect from happening in the first place, to stabilizing families where something has already happened, there's already been a crisis, now they're at the door of the child welfare system, helping the system currently take care of children who are in the system, and also helping those older youth who are transitioning out onto their own right now during this crisis. The child welfare community has submitted specific asks to Congress in this regard, which I will have Allison at the CDF Ohio office circulate to those for their awareness. But we are urging for significant investments in federal child welfare funding right now, because we know that states across the country and child welfare systems are going to be reeling from the draconian cuts that we're going to be seeing because of the economic downturn that every state is going to experience because of this pandemic. The Senate is still working on their fourth package for the COVID relief response, and there is no confirmed date or timeline for when that Senate will move on that piece, but we are hearing conversations that the Senate is trying to move on this before the July recess. So really the upcoming days and weeks are absolutely critical in trying to elevate the needs of the child welfare system and the children and families who are served by them. Before I turn it over to our Ohio partners, I just really wanted to close and reiterate how we really must protect the children most deeply impacted by the COVID-19 pandemic and ensure that this temporary crisis does not cause long-term lasting impacts on their safety and well-being. This crisis has the potential to continue exacerbating the existing racial disparities that we unfortunately see within the child welfare system and really hit our most vulnerable children and families the hardest and potentially long-lasting. So thank you for having me during this conversation.
Thank you so much, Stephanie. We appreciate all the work you're doing in Washington. We will now move on to three of our speakers here from Ohio. We are really honored to have these three top-notch professionals with us here today that are very much in this space. First, we will hear from Angela Sausser. Angela is the Executive Director of the Public Children's Services Association of Ohio, better known as PCSAO. And then we will hear from Dr. Jonathan Thackeray, who is the Chief Medical Community Health Officer at Dayton Children's Hospital and an expert really as a pediatrician in the care of abused children. Our final speaker will be Mark Mecum. Mark is with the Ohio Children's Alliance. He is the president, I believe, and we are just very honored to have all three of them here with us. And I'm going to turn it over to Angela to kick this off. Thank you, Angela.
Thank you, Senator. Good afternoon, everyone. Thank you so much for inviting me to be part of the webinar and the opportunity to discuss the impact COVID has had on children's services and what moving forward looks like for our field. Next slide. So if you're not familiar with the Public Children's Services Association, we are a membership-driven association. We represent all 88 county children's services agencies that are either situated within their job and family services departments or as a standalone children's services board. Next slide. So I thought to discuss the impact of COVID on our system, we really need to look at where our system has been. And our children's services system here in Ohio has been in a very severe crisis. And as Stefanie was saying, this was largely attributed to the opioid epidemic that ravaged our state between 2013 and 2018. The opioid epidemic led to more children coming into foster care, and those kids had more complex needs. And with such a dramatic increase of kids coming into care in such a short amount of time, we were really struggling with trying to find available and appropriate placements for kids. Our placement costs were skyrocketing, and our workforce was being burnt out. And this was really felt even more by the local agencies because they had remained flat with state funding since 2008, which is when the last recession was here. And it wasn't until state fiscal year 18-19 when the General Assembly made an investment in our system. Next slide. And then under the amazing leadership of our governor and our current General Assembly, they really started to turn our system in the right direction. An unprecedented investment was made in this biennium budget for our system. This investment really focused on stabilizing us from this crisis, looking at how we could recruit more foster parents, how we could provide more supports for caregivers, how we could address our workforce crisis and really start meeting the needs of the complex multi-system issues our kids experience. And we were beginning to stabilize and really looking forward to the transformation that was coming to Ohio, one being with the Family First Act at the federal level, and then also through our governor's Children's Services Transformation Office and Advisory Board. And we were really hoping that we would be able to reach the goals within our own Children's Continuum of Care Reform Plan. Next slide. And then unfortunately, COVID came to Ohio, as Senator Lehner mentioned earlier, this has had a significant impact on our children's services system. We have seen a significant reduction in reports of abuse and neglect. When looking at April 2019 report data to April 2020, we've seen about a 43% reduction in reports, and it's exactly what Senator Lehner said. It's because our mandated reporters, teachers, healthcare professionals, social workers don't have eyes on kids right now. Another challenge we saw was because of the fear of contacting COVID, many of our families would put signs such as the one on your screen that would prevent our workers from having access to the children and to the families because they weren't going to open their door during COVID. And then our agencies were really worried about spreading COVID among kids and families. So we essentially sheltered kids in place. So wherever they were, we were encouraged not to move them for fear that we would spread COVID. And then our court system had to transition to virtual hearings, and they had to prioritize cases that they were going to hold hearings on. Our families struggled to access treatment services during this time, and we essentially had to stop face-to-face visits between families and their kids. All of that impacts permanency for a child, so we have seen a delay in permanency decisions for kids during COVID. And then we've remained somewhat steady for the kids in custody. We're currently at around 17,000, which is actually 1,000 more than during the opioid epidemic. We were at 16,000 then, and we're now up to 17,000 children in care today. So while all of this is very concerning for our agencies, we have seen some innovations gained from COVID. Obviously, being a county agency, we have remained open for business. Children's Services is deemed an essential service. We've just had to adjust what our business looked like. We have found some remote work efficiencies. Our caseworkers have reported that they've been able to spend more time on cases remotely, that they've been able to spend more targeted time on documentation for their cases. And they've also seen more collaboration within their own peers of their agency. We've seen a lot of benefits from virtual visits between families and kids and workers and caregivers, so we would really like to see virtual visits continue as a supplement to face-to-face visits. Our courts have responded that more families are actually engaged in virtual court hearings than in-person court hearings. And our own agencies have said that our families have been more engaged in team-based meetings virtually than in person, which may be because families are more comfortable in their own home than in a bureaucratic, intimidating building. So we would like to pursue virtual hearings and meetings as an option to families as well as to youth. So we've become more creative in how we've engaged families through COVID, which is a positive. Next slide. And we've been highlighting some of the creativeness among our staff. So we started to share stories a couple of weeks ago. These are really to talk about the challenges our workers face, the families face during COVID, but also some innovations that really lead to hope and courage as we move forward. So I encourage you to check them out. They're on our website at PCSAO.org. Next slide. So when we think about COVID recovery and moving forward, we really have three main buckets that we need to be thinking about. One is obviously this recession that's going to have a significant impact on our state and local budgets, and obviously fears of major cutbacks is on the mind of every single children's services director today. We do anticipate a surge, as Senator Lehner mentioned, of children coming into care this fall when schools reopen. We may see a surge with childcare reopening and some more social and faith-based gatherings occurring right now. Just time will tell on that. And then obviously this past week has really shown a spotlight on the inequities among our African American population and the disparities felt by marginalized communities during COVID. The Children's Services System has always had a disproportionate number of African American and other minority children in care. And unfortunately, they see poor outcomes. They tend to stay in care longer. They don't gain permanency as often. And they're unfortunately placed in more restrictive settings like facilities and institutions. So this must be addressed. Obviously, the time is now, and we really need to focus on that. So these three new issues come forward from COVID at the same time that we're already focused on Family First Prevention Services Act, which Stefanie gave a great overview on. Ohio has been planning for this. They continue to plan for it through COVID. Our target deadline is the federal mandated deadline, which is October 1st of 2021. Which is when we plan to bring forward evidence-based prevention services that would allow us to keep children from coming into care due to the first time ever having Title IV funding available on the front end. Those do require a 50% match. And then the second piece is our facilities have to start meeting some new requirements, qualified residential treatment program requirements, by October 1st of 21. And if they do not meet that, they will not be eligible for federal 4E funding. Next slide. So from the federal level, what we really need is support. We completely support what Stefanie shared, the Children's Defense Fund's recommendations for increased federal funding streams for children's services. To date, we have not been included in any COVID-related bills. We also need Title IV considerations so we don't lose federal funds. We had to make practice changes during COVID and we should not be penalized for that. And we would really like to maintain the increased 4E match rate or FMAP so that we can maximize state and local funding. And at the federal level, the Administration for Children and Families has granted us some flexibility and allowed for things such as virtual visits and purchasing PPE with federal funds. We would like to keep that going forward because this is our new normal. Next slide. And then if we look at the state level, we have to maintain the children's services budget investments we got in this biennium budget, including those for multi-system youth. And we need to maintain that going into the next biennium budget. We really cannot go back. We have to go forward. We have to maintain the option for emancipating youth to remain in care during the pandemic. We really appreciate Governor DeWine making this decision and support this policy continuing into the next fiscal year. And our State Department also granted us waivers and flexibilities during COVID, and we would like those to be extended as part of our new normal. I do need to highlight that we really need to pass House Bill 8, foster caregivers. This would give us more flexibility with foster caregiver training hours. We desperately needed this during COVID, but because this bill has not passed, we weren't granted that flexibility. So really encourage this General Assembly to pass House Bill 8. And then finally, we need state funding to assist in meeting the 50% match for prevention services, which will come into play in the next biennium budget. So we encourage all of you to get involved, reach out to your local children's services agency, learn more about Family First, governor's work on transformation, and our own children's continuum of care. We do have a lot of these materials, next slide, on our website. We are also on social media, so feel free to check that out. Thank you for your time, and I'll be happy to answer any questions during that portion of the webinar. Thank you.
So thank you, Senator Lehner, Representative Russo, and members of the Children's Caucus for the opportunity to speak with you this afternoon. My name's Jonathan Thackeray, and I'm the Chief Medical Community Health Officer at Dayton Children's Hospital. My clinical work for the last 15 years has been as a pediatrician who specializes in the evaluation of children with suspected abuse. And before I talk about the effects of the current pandemic, I think it's important to remind ourselves that, violence against children affected a significant proportion of youth in Ohio and across the country even before the pandemic was declared. And you've heard some of the statistics, and I won't repeat them, but I think it's important to remember that the numbers on reported abuse are gross underestimates of the magnitude of abuse that occurs. It's that tip of the iceberg that we always talk about. But that was before COVID-19, and history tells us that an event like this pandemic should worry us that a surge, and you've heard that word used a couple times, a surge of child abuse is on its way. And if you look at studies of past large-scale international emergencies like tsunamis and earthquakes, studies consistently show that violence against children increases following these events. One of the more recent events here in the United States, for example, was the recession of 2008. And there were several studies that showed rates of shaken baby syndrome or abusive head trauma increased at that time and persisted for some time after. And so why is that? It's because the risk factors for child abuse and child maltreatment include things like financial stress and substance abuse and caregivers dealing with mental health issues and lack of social supports. And all of these are exacerbated in a time like this. As Representative Russo mentioned in her opening comments, these stressors weren't distributed evenly among our communities before the pandemic, and now the disparities and the gaps have only been worsened. So families in lower socioeconomic status are facing greater social and economic pressures than others in this time of crisis. So in just a few short weeks, the virus really dramatically changed the lives of everybody, including children and families. Caregivers have lost their jobs, finances are strained, and all of this at a time when children also lost access to the family and friends and systems and professionals that play a critical role in identifying and reporting abuse. If you take educators, for example, over 20% of reports to Child Protective Service agencies come from education personnel. And so teachers, guidance counselors, early child care providers, home visitors, they are a safety net for our children. And as you've heard, much of that safety net was lost for months. And again, you've heard calls to the state reporting hotline for child abuse were down. And as Senator Lehner mentioned, it wasn't, unfortunately, for the reasons we would like it to be. So in light of that, we've expected that caregivers dealing with additional stressors of losing a job, having children in the home 24/7, we're going to be more likely to get frustrated and physically harm a child. We're starting to see these cases increase anecdotally in number across Ohio children's hospitals. I saw 2 young children this morning with concerns for physical abuse. We expected that children would experience more domestic violence and have less access to safer environments. And we're seeing a large portion of recent calls to the National Domestic Violence Hotline citing coronavirus as the reason for the call. So now the state is starting to reopen, and we're thinking about if and how we live with social distancing. But it's important to remember that the stressors I mentioned haven't subsided at all. People are still out of work. Basic needs like food and shelter continue to be a struggle, again, especially for the families who need it the most. So what would I recommend to parents, to pediatricians, to educators, to others as we start to see children sort of emerge from their homes more and more? To parents, I ask them to remember that our kids thrive on routine and predictability. I ask them to remember that our own stress levels are sky high right now. It's important for parents to plan to get away from children for brief periods of time. And it's important to remember that we as parents have to cut our children some slack, right? We have to find the good moments and the good behaviors and praise those instead of waiting for the next thing to go wrong or the next bad behavior. To my fellow pediatricians, I ask that we continue to look for signs of abuse, distress, and other warning signs in the children we care for. We have an opportunity to listen to children and encourage them to describe their feelings. We can validate for them and for families that this is a really difficult time and provide support. And we can advocate for policies that support our families at highest risk. To educators of all types, you've heard a couple times now, they're key to this. As our child care centers reopen and soon hopefully our schools, it's important that they remain vigilant. Identifying a child with an unusual bruise or a child without the appropriate food or clothing, or just acting upon a child who makes a brief statement about feeling unsafe at home can make all the difference in a child and a family's life. To the community, I ask that we continue to think about how we best support each other, especially right now as we confront the uncomfortable realities of personal and institutional racism. Social distancing doesn't need to prevent phone calls or emails to neighbors and family. It doesn't need to prevent helping get groceries for those who can't get out of their home. It doesn't keep us from providing clear messages to families about where to get resources for parenting and meeting their basic needs. I have colleagues at Washington University, and they've shared it's imperative that we do everything we can to be aware of the well-being of children in our communities. Prevent Child Abuse America is an excellent resource. They have a number of tips and resources related to COVID-19 for parents, for children, service providers, and the community as a whole. And their website link will be referenced in the chat here. But I think it's important to remember we shouldn't expect to rely on the eyes of mandated reporters right now to call in concerns of abuse. Voluntary reporters are going to be critical for the next several months at least. And so if somebody doesn't know how to report child abuse, but they have a concern, I'd encourage them to contact their local county children's services agency or the Child Help National Child Abuse Hotline, and they will guide you through the process. And last but not least, to the members of the Children's Caucus, I will ask that you please remember the strain that this crisis is placing on everybody, but especially the people dedicated to serving the needs of families and protecting children who, right now find themselves in this totally new and frightening context. Providing for and encouraging child welfare workers to reach out for mental health support, I think is needed now more than ever. When the dust settles from this pandemic, I will ask that you think about a crisis preparedness plan for the child welfare system that includes the courts and community agencies before the next crisis is upon us. And finally, and Stefanie touched on this in her comments, I'll just ask that you remember that even before this pandemic, the economic case for preventing child maltreatment was crystal clear. And so once we've addressed the immediate needs of our families, I hope that we can use this as a catalyst to build an even more effective system to alleviate the material and the psychosocial needs and all the disparities within them that get in the way of positive parenting and healthy child development and well-being. I have no doubt we can do it, but it will certainly take all of us. So thank you.
Okay. Thank you so much, Doctor. We will now conclude with Mark Mecum from the Ohio Children's Alliance. Mark, are you there?
Yes, I am. Thank you, Senator Lehner.
Good. All right.
Yeah. Well, thank you all for this opportunity. So again, I'm Mark Mecum. I'm the CEO of the Ohio Children's Alliance. We're a statewide advocacy organization that advances positive impacts on kids. So we're always excited and eager to discuss how our state can improve outcomes for kids and families involved in the child welfare system. And that's really our mission. So before I dive in to identify a key challenge and a key opportunity, I just wanted to take like 20 seconds to describe the private child welfare sector and how they fit into Ohio's child welfare system, because most of my comments later will be kind of focused on their role. So first, there's about 150 community agencies in all of your districts, most of them nonprofit, many faith-based, that serve kids and families, including those that have open child protection cases. And some of these kids become foster kids once they're placed into out-of-home care. So these agencies all throughout Ohio primarily provide family preservation and mental health services to keep families together. But when that's not possible, they arrange for kids to live with other families, kinship, foster families, or even in treatment facilities if needed, until they can return home, get adopted, or find some other form of permanency. So these are the agencies throughout Ohio that the Ohio Children's Alliance equips for success. So I'm going to highlight a major challenge and a major opportunity. So the first challenge, we've already addressed it a bit today, and that's the impact of traditional in-person school either not happening or when it reopens in the fall, reopening on a limited basis. So I'm sure you've seen many of the articles. They are referenced already, including the May 31st Columbus Dispatch article about whether school closures are the cause of the 36% drop in child abuse and neglect cases. And I'm sure there's a very strong correlation. Teachers and school therapists and other personnel are mandated reporters, and if they can't see kids physically, then they're not seeing the trauma that comes along with abuse and neglect. And therefore, this abuse and neglect is most likely still happening, and it's just not being reported as consistently. So what we should all take away from this is families are struggling, and bad things are happening, and we probably aren't as connected or supportive today as we once were. We haven't fully transitioned to this, what I hope is in a long-term normal. So if school districts are going to reopen in the fall on a virtual basis or on what I'm hearing, a hybrid basis, we have to keep in mind that without school, families can quickly get off balance and get out of whack. I know mine sure did. So if this is the case, school personnel need to be more mindful of their obligation to detect abuse and neglect, even though they'll have less face-to-face time with their students. And I'm not sure that all of our school districts and schools and the thousands of personnel are really prepared for that come this fall. We also have to be aware of the responsibilities of schools to transport their students to alternative schools. And that's where many, over 1,000 students in Ohio, that's where they go to school, and that's also where they receive mental health care. And a lot of these places, which in our sector we call them day treatment centers, many of my member organizations operate these. So the responsibility of the school to transport kids to their alternative school setting must remain, even if their school district reopens in the fall on a virtual basis or limited basis, because some of their students don't go to those physical schools. They go to alternative settings, and they need reliable, safe transportation that doesn't require their parents to come with them for every trip. So the Ohio Children's Alliance member organizations who provide mental health services to kids around Ohio also provide them inside hundreds of schools, traditional schools. And since March, these organizations have transitioned to telehealth as a platform to reach their students. So while we all quickly adapted to telehealth, and while all of us quickly adapted to Zoom, achieving good therapeutic outcomes with kids on the other end of a phone or tablet is quite challenging. Getting them to show up on the screen is a challenge in and of itself. Getting them to be engaged, and getting their parents engaged virtually, that's an incredible challenge. So if this is the new normal for how some of our most vulnerable kids can get mental health therapy, then as a state, we need to invest in this new platform, this new arrangement, so it's successful, because we can't afford for the thousands and thousands of kids that are suffering with mental health issues to go without having access to quality mental health care. So I think that is one of the biggest challenges that we face, but a great opportunity that we have before us that's already been mentioned is the Federal Family First Act. So if we're interested in children's services transformation in truly advancing racial equity in our child welfare system, then we really need to flip our child welfare system upside down. And Congress attempted to do that when they passed the Family First Act, which was in 2018. The law itself is not perfect, that's for sure, but it still gives Ohio and other states an opportunity to take some bold steps toward achieving transformation. And there's two key areas. The first is keeping families together and boosting the quality of group homes and residential centers where kids in foster care live on average of about 12 months per stay. So Ohio plans to implement the Family First Act next fall, like in 2021. ODJFS has received a planning grant from the federal government of $18 million to help prepare our system for successful implementation. And we have like a 5-year time period to have that money spent. So I'm trying to put myself in the shoes of state lawmakers. I would look at the Federal Family First Act. While it's a federal law, it's really a state government tool to achieve fast and transformative reform of our child welfare system. If we want to stem the tide of kids entering foster care, if we want to shift our financial resources to serve families more upstream and prevent them from even getting involved in child welfare, then we need to really maximize the Family First Act. And now we have this unusually large sum of money of this $18 million planning grant to actually help us achieve that. And when does that happen with federal mandates? So even minor percentage changes in our child welfare outcomes in Ohio can have an extraordinary impact, not just on kids and families, but taxpayers as well. You know, our child welfare system in Ohio costs about $1 billion every year. So in closing, I just wanted to thank you all for supporting Ohio's kids and families. And I realize that budget cuts are right around the corner and they're necessary. But I have to stress as an advocate, investment in our kids is also necessary. And due to the Family First Act, we now have this unique window of opportunity to maintain the recent gains that many of you all are responsible for in our child welfare system, all the while leveraging these new federal funds to achieve real transformation. And I look forward to you and all Children's Alliance members look forward to partnering with you all to see this progress through. Thank you.
Thank you to all four of our speakers. There's a lot of information here and each one of you could probably take several hours, but we have about 10 minutes left and we hope in that time to get in some questions from our legislators. So is there anyone who would like to start off?
Senator, it's Hackett. I have a question.
Go ahead, Bob.
Yeah, and it's for Stefanie. Stefanie, you know, you're aware, you know, when the first dollars came down from CARES, there was a decent amount going to local governments, but the problem was it was pretty restrictive of how they could spend the money. And they worked with the Senate where we developed legislation that we basically, you know, actually approved less than a third because we wanted to change the rules of what they could use the dollars for. Has there been any thought at the federal level, as they're getting this change to give more flexibility to local governments, to have some of that money that's sitting there to be used at all? I mean, I haven't seen you guys, and I realize county commissioners and mayors want the flexibility and make the decisions of how to spend money, but sometimes it's not, I'm a former commissioner, sometimes it's not bad to just say, you know, X amount of dollars need to be allocated to child care. So is it because there are just so many other areas that local governments deal with that they don't want to be specific? Because the problem with the dollars was that they had to be spent on corona-related activities, and some counties actually even having a problem to create that amount of money. And they came to us and said, we want the ability to use it for operations, for payroll, and to operate our system. So Stefanie, has there been any movement at all with you and the federal people to try to change the rules to be able to redirect more monies to the child care system?
Yeah, no, we have heard similar concerns from our other state partners that the dollars are being stuck right now and there are these battles on how they're being used. I think unfortunately, I'm not sure that there is much conversation right now about how we can be designating some of those dollars towards certain activities. I think that's largely because from what we've heard from our congressional partners, they're trying to keep the federal response money as flexible as possible. Which is why we are really hitting hard that if that's the case, then we need to have direct funds currently going to the federal child welfare system under already current federal funding streams. So we're looking at additional funding in Title IV-B Part 2, CAPTA, CHAFE, Contingent Navigator programs that are pieces of the Family First Prevention Services Act, with the goal of being able for child welfare agencies to use those dollars, not have to fight for it within the other partners within the state.
Okay, thanks. I hope the question wasn't out of whack, but you can see
No, we have been hearing that.
No.
Okay, thank you.
Do we have another question out there?
Senator Lehner, I have a question.
Yes.
Um,
Sure.
Thank you.
Senator Kunze.
I know I've been working with several constituents in my area who are really concerned about the kind of the programs that normally take place during the summer, kind of the day camps, summer camps, that really children that are at risk desperately need. And I had I've had several conversations with the governor's office and the governor and lieutenant governor. But have you guys heard across the state, are some of those programs that are normally available, have you heard if any of those are reopening or starting back up, or what those, I know some have switched to like a virtual program, like a summer lunch program, but have you had any contact with some of those, the supports that are out there outside of school that normally have eyes on children and, are another loving, caring person that can also keep an eye out for abuse and neglect? Have you heard anything about anybody reopening yet or plans to do so?
Who wants to take that?
Or just say no if you haven't heard.
Sure. So this, Mark Mecum from Children's Alliance. I'm aware that several of my member organizations that have traditionally held summer camps or similar terms for, therapeutic recreational activities for underprivileged kids, that they have quickly turned them back on and reopened them. I know Cincinnati Enquirer just profiled Children's Home of Cincinnati, just reopened their summer camp, which I think hundreds of kids rely on in that community. But also being a father who desperately needs camps for my kids, I know that they're either mostly canceled or those that have come back on such a limited basis that their capacity has declined significantly. So it's just not where we all really want it to be, from my experience so far.
Right. I know the governor just came out with some new guidelines on day camps, et cetera. So hopefully we're going to see some of those ramp up here very quickly. But it's pretty late in the planning stage. So did you have a follow-up, Senator, or anyone else?
No, I was just hoping that maybe there was some activity out there that I didn't know about. But Mark, thank you for the update.
Yeah. I don't see anyone else. Go ahead.
I'm sorry, Senator. This is Rep. Boyd. Thanks for.
No, that's great. Jumping in.
Good, great seeing you guys and hearing from blasts from the past like Mark and CDF. So I appreciate this. And I just wanted to bring to everyone's attention, I was on a call earlier with Cleveland Metropolitan School District's superintendent, and we discussed in detail the guidance from Secretary DeVos on funding for public schools. We know when we're talking about child welfare, we can't leave out the schools, right? And with the Ed Choice scholarships, scholarship program, and other things that have just deterred funding and dispersed it elsewhere to our schools. This is, our schools are our refuge for our children. They've been a refuge during the pandemic, and some of the guidance from Secretary DeVos will make moving forward, whether it's a hybrid model or not, a big challenge for our public schools. So I think that it would behoove us all of us who are participants in the Children's Caucus to also participate in advocacy around making sure that our public schools, which are community schools, I mean, if you look at where public schools are built, they're built in our communities. They've been distributing meals this entire pandemic, and they've been distributing them to even children who don't attend their buildings and whose families have, by their own choice, taken scholarships and gone elsewhere. So I just think it's important for us to not leave the schools out. They are our natural partners. Our teachers are also experiencing the pandemic, as well as the heightened climate of racism and disparity that we're experiencing. They're also parents, a lot of them. And so we're all connected. And one of the things we need to make sure we try not to continue to do as legislators, I think, is to legislate in vacuums and remember that all of our policies are connected in some way, and they impact families in a connected way. They impact our education system in a connected way, and our children, therefore, in an impacted way. So I just wanted to bring that to everyone's attention. And thanks again for putting this together, as always.
Thank you so much, Representative Boyd. I appreciate that.
Yeah, Rep. Boyd, this is Rep. Russo. I just wanted to jump in here and say that specifically on this issue of schools and education, this is an upcoming topic that we're going to delve into very deeply as well. I don't know if it's in 2 weeks, our next webinar, or the one after, but it is definitely on the schedule for us to talk about in depth, because it is such a critical issue for our children. And we know that often children are safer when they're in school and thinking about all of the complicated issues around that topic.
By the way, I see it's popped up on the screen that the Freedom Schools are going to be operating this summer. I was told that they were not. Is that something new? Does anyone know? The Children's Defense Fund Freedom Schools? Okay, apparently no one knows. I'll have to look into that one. I know that's been an important outlet for a lot of districts.
And I'll say, having run Freedom Schools, I'm sorry, Senator, this is Rep. Boyd again. I would just say, having run Freedom Schools in the past, I would say that it's probably easier to operate according to health guidelines and preventing community spread, operating summer Freedom Schools than it is regular school, because of the numbers of youth that are participating. I'll just leave everyone with that. It's probably easier.
Okay. Well, I hope that's not a rumor. Do we have any other questions out there? Not seeing one, I'm going to ask each of the panelists real quickly to just tell us, we're heading into the summer. The legislature doesn't tend to be in session very often over the summer months, particularly in an election year. So given a rather limited calendar, what is the number one thing that you think needs to occur legislatively over the next couple of months? Anyone want to? I heard House Bill 8 was critical. A crisis preparedness plan was critical. Maximizing the Family First Act. Anyone have some thoughts on that question?
Sure, if I may jump in terms of very near-term goal, I know there's a bill in the House and bill in the Senate that addresses liability as it relates to COVID-19. Ensuring that these community agencies that are serving kids and families are immune from liability from COVID-19 related lawsuits is critically important. Not just the businesses, but the practitioners themselves. And I know the Senate bill, I believe, is focused on healthcare only. I just want to reiterate that healthcare and social services often are intertwined, and not all organizations.
The Senate bill
Mark, let me interrupt, Mark. That's not true.
The Senate bill has all
if you talk to Senator Huffman, he'll tell you that's not true. It's just that because the healthcare system already had some built-in immunities, that the bill talks about that, et cetera. But one of the questions came up was, why didn't he just describe every occupation, but new occupations bounce up? But no, you watch, when you read Senator Huffman's bill, it does include almost
Much
everybody.
broader. Yeah.
It is it's much broader than the House. And actually, we're hoping that's the bill. And we just got it passed on the floor. So
Yesterday.
yeah, we sure hope that
Wednesday.
Wednesday. So don't you agree, Senator?
Yeah, absolutely.
Yeah. So that's not true, because that rumor was going out that it was only health care. I think that's because when you read part of the bill, it talks about the existing law, the way it is set up with the protection of the health care things. But when you read the entire bill, it does give protection in almost every area.
With that unusual bit of good news, we can end on a positive note. It is 2 o'clock, and I believe that we need to wrap it up at this point. I want to thank everyone for participating, particularly our speakers. You did an awesome job, as we knew you would. And this is going to remain just a huge, huge issue. It was before we went into COVID. Certainly COVID has exacerbated it. I think we could have also discussed whether or not the latest crisis with the unfortunate, use a mild word, death of George Floyd and everything that has led to since then is probably adding to much of that angst that we're all feeling. So appreciate everyone being with us today, and I look forward to having you all back in a couple of weeks for our next webinar. So thank you very much.
Thank you, everyone.
Thank you.